In this presentation, we will be talking about palliative care delivery. The presentation has been prepared by Dr. Dinesh Kumar, Professor, Department of Community Medicine, PSMC, Karamsad, Gujarat. The objectives are to enumerate various settings in which palliative care can be delivered, describe the common palliative care delivery models, and we have already learnt about the home care. What does total care involve? Again, I would revise it: the physical care, which involves the symptom management, which includes the pain management, psychological care, social care, as well as spiritual care. Again, let us revise that at the time of diagnosis, what happens? The patient receives the maximum curative treatment, but we start with a little palliative care too. In the course of illness, with the passage of time, what happens? The patient receives maximum palliative care and the treatment is discontinued. It is followed by end of life care, death and bereavement. When we are talking about the family, we are covering up to bereavement. Palliative care services locations may be, again let us revise, it may be OPD, it may be home, it may be a hospital or daycare center, and it may be a hospice. What are the approach? There may be specialized referral services, there may be hospital to deliver palliative care. Now, when we are talking about home based palliative care services, the patient has to be willing and it should be available by the caregiver. There should be a conducive environment, a trained team, 24-hour support, home care kit and support network. The advantages are comfort, privacy, familiarity with the surroundings, security, autonomy and greater degree of independence when it comes to the patients. There is sense of involvement for family as well as the community also. Reduces single-minded focus on the disease with greater willingness to discuss spiritual and psychosocial issues. We should always understand in palliative care, it is the psychosocial and spiritual component which is very important, because when we address it, even the pain and other physical symptoms, they are treated simultaneously. It has to be realistic assessment of the patient and family, and overall the treatment has to be cost effective. Now, in case of outpatient care, it is the commonest model in case of palliative care, needs less resources, can be easily integrated with existing facility. It can be used for sensitization and demonstration of benefits of palliative care within the patients. So, here Dr. Geeta Joshi is seen to be consulting in OPD with the patient. So, outpatient palliative care components are a doctor, a nurse, trained team, essential medicines, support system and adequate space. In case of hospital based care, which is useful for integrating palliative care in general health care, specialized units or shared beds can be allocated. A specialized team of palliative care approach should be there, and short term hospitalization and crisis and respite care should be also undertaken. So, we can see the patient is being supported by physiotherapists, social workers, psychotherapists, nurses and general practitioners in hospital based care. Hospital based care is useful for integrating palliative care in general health care, as it can be easily adapted by the hospitals. Specialized units or share beds can be arranged if special units are not available or special beds are not available. A specialized team or palliative care approach may be followed. If required, short term hospitalization or crisis or respite care can be given. There can be continued involvement of primary treating teams. In case of day care, the combination of outpatient and hospitalization both are considered. It supports the family. It is an extended care for the patient. It helps in symptom control and respite care, because the family gets relief from overlooking the patient, as it is really very cumbersome to take care of a terminally ill patient, and the entire family is also disturbed when they take care of the patients. So, they get respite in case of daycare services, and the simple procedures are also performed. In case of hospice, the approach can be within any health facility. It is exclusive inpatient facility. It is only for patients who need palliative care, and it is focused on comfort care, not for treating the patients, and we involve training of the families. Again, I would like to clarify, hospice is different from the hospital, because here only palliative care patients are admitted and care is provided, whereas in case of hospitals we treat the patients, and normally hospitals do not admit palliative care patients. In the hospice, the patient may stay for a few days to weeks. Symptom control may be one of the components. Respite care to the family is another issue, and again end of life care is given. Thus, all the dimensions of sufferings are handled by a specialized team. So, how to start palliative care services? Sensitization of volunteers, training of volunteers, nursing services and facility based services. So, one by one we climb the ladder. What is the proposed model under National Program for Palliative Care? District hospitals should be having 10 beds of indoor palliative care unit. PHC or OPD clinic should be there. Health and wellness center should be having outreach for palliative care. We have been talking about the Kerala model of palliative care, and we should understand that Kerala is the only state which has excelled in giving palliative care services to the patients, and they have home care services, they have IPD services, they have OPD services, and here a lot of volunteers are engaged and providing support to the patients. Thereby the entire community is involved. The state policy in case of Kerala model is that district hospital, CHC and other hospitals, they have a inpatient unit, PHC has OPDs, panchayats and NGOs, they conduct outreach activities, and thus we have a community participation model which includes volunteers, and this is what is the perfect example of intersectoral approach. So, to summarize, several settings are available to offer palliative care. Home care is considered the best mode if it is possible. Each mode has its own pros and cons. Thank you.